All right, there's a lot of intrigue at the palace tonight as the British royal family released a pair of surprise announcements today, fueling new questions and concerns about the health of the two of the highest-ranking royals there are. The first announcement came from Kensington Palace that Catherine, the Princess of Wales, was admitted to a hospital yesterday where she underwent planned abdominal surgery. The palace released this statement saying the surgery was successful and that Kate is expected to remain in the hospital for 10 to 14 days. Little else was revealed except that her condition is not cancerous and that the princess wishes her personal medical information to remain private. Then, about an hour later, Buckingham Palace announced that King Charles has health issues of his own. Next week, he will undergo treatment for an enlarged prostate. The palace said it's a corrective procedure for a common benign condition. He wanted to let people know to encourage other men to get checked. Secrecy versus transparency. So what do we really know? Joining us now is Rob Shooter, who worked as a publicist for a member of the British royal family and is now hosted the podcast Naughty But Nice, and Dr. Jen Caudle, a family physician and associate professor of Rowan University. Rob, I want to start with you. Kensington Palace announced the news of Catherine's surgery this morning. It contained an apology from her that she was going to miss a lot of upcoming engagements. This is like for months.
Yes, yeah.
It's a long time.
It's serious. All my sources are telling me this is very, very serious. And the fact that the palace has been so secretive about it certainly isn't a good sign. But I do agree, the statement was so Kate, it's so remarkable, and even Charles's too. This was about other people. She's going to miss all these engagements that she has planned. She has vowed, the palace has vowed, that she will make them up. Now, this is where it gets very, very complicated. Why, if this was planned, this surgery,
right,
did they schedule events, engagements for her over the next couple of weeks? If they knew about this surgery and knew how serious it would be, they'd just block off a month on her calendar. That's what they normally do. So this may be an indication that it took them by surprise.
I think planned is just the opposite of emergency, right, as in, all right, doctor, 10 to 14 days, they say she's going to stay in the hospital. That is a long time. What kind of abdominal surgery? I mean, I had an emergency C-section and I was in the hospital for 5 days, not 10 to 14.
Right. There's actually a lot to unpack here. And just going back to the previous point, I do agree with you, Elizabeth, in terms of planned versus emergency. That's how I'm interpreting it as well, is that this was likely not an emergency surgery, which is good news. Planned doesn't mean it's any less huge or big or important, but it's good that it wasn't emergency surgery. Yes, I do think that 10 to 14 days is a long time.
Yeah.
I do. It's a long time for American standards for many surgeries, even many emergency surgeries, to be honest with you. I think there are a couple of things, a couple of questions that may be playing a role here that I don't know that we all know the answers to. Number one, what's the standard in the UK? Okay, is this sort of standard of care? Is this standard of care for people who are part of the royal family? You know, maybe this is because she is a princess, Princess Kate, that they're taking extra precaution. We don't know. And then the third variable is really what we're talking about here is, well, what exactly did she have done? Does she actually require all that time? And that's why they said 10 to 14 days. But there are a number of things. I don't want to go on too long, but from hernias to pelvic surgery, et cetera, there are a number of possibilities here.
But still, they said that she won't be appearing publicly again until after Easter. I mean, I'm
Right.
still puzzled as to what abdominal surgery there could be that would require this much recovery time in hospital and that much
Right.
recovery time at home.
Well, and also remember, too, how the surgery is carried out depends oftentimes on recovery. You know, surgeries can be done laparoscopically, which tends to mean sort of a more minimally invasive procedure versus an open procedure. But even still, when there's, again, emergency surgery, sometimes open procedures, people don't stay for 10 to 14 days. You know, again, I'm wondering if there are other variables playing a role that we simply just don't know, that may be going beyond the reason. But I also want to just caution us, too. The royal family in the press release talked about abdominal surgery, but I also want to remind us, yes, in our abdomen, we've got the liver, the spleen, and the gallbladder, right? And, you know, hernias, gallbladders, plenty of things that can happen. But with women, we have the pelvis and we have reproductive organs, our uterus, our ovaries, et cetera. So
could be anything.
that also, right. So that opens up the possibility of what might be going on here.
Thanks so much for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.